normally comes and looks like this in blocks. Okay, it's usually a 5-to-1 or a 6-to-1 ratio of mineral oil and wax. Okay, usually you need about 5 to 6 of them to fill up one container. The container is typically held up here. I'm gonna move this chair. The container is generally filled halfway up. There's 3 different levels inside of here that tell you which one is which. Usually we fill it up to the second one. Because it's lab and we're regenerate, we usually keep it a little bit lower so that way we don't waste a lot of unused wax. Anytime the lid is off, it cools off. Okay? If you notice, there is a metal ring around here. This metal ring is a conductor. You don't touch the sides of this and you don't touch the bottom of it. And you need to make sure you tell your patients to keep their hands still, keep their hands off the side, keep the hands off the bottom of it. The temperature of the paraffin wax is maintained at 125 to 127 degrees Fahrenheit. That's the normal. All of these details are right out of your Hayes manual lab. You do not have to write any of this down. It's all there, printed. Pay attention and do. For those of you who love to write, you miss it because you're looking at the paper. So put them down. Okay. We have temperatures here. We've already checked, thanks to Esteban, that everything's all set. So assume that we put this in. And this is now, it's at 125 to 127. Keep in mind that paraffin always feels cooler than water. Okay? What I mean is, if I had a same temperature of water, 125 degrees water, next to 125 degrees paraffin, the paraffin will feel cooler even though they're the same temperature. Okay, that's because they've got different specific heats. Remember that principle? So initially it may feel really hot when they put their hands in. And so you can normally expect it's going to feel like a rush of heat to come over you for those things. You can do 3 different techniques for paraffin. There is a immersion bath, which is when the patient stands, puts their hand into the paraffin, and then they hold it there for the entire duration. Who can stand still for that long? Okay. It is the most effective method because it maintains the most heat. The unfortunate part is no one can stand still like a statue for that long, and it's not comfortable to stand like this for this long. Even to sit like this for this long. It doesn't work very well. So you don't see it done very often clinically. But know that immersion is a possibility. Then there is the dip immersion, which is a variant of instead of standing here the entire time, you would dip your hand once, let it sit there for a few minutes, and then pull it out, and then dip your hand again. And then you still stand for the rest of the time. Again, depending on, it is the medium heat. Like if you're going to compare things in terms of heat production, the immersion is the best to relay the thermal heat. The dip immersion would be the second best. The least effective is the one we all use. Gotta love it. Which is the dip and wrap technique. Okay, so that's the one we're going to practice, and it's the one that is mostly done in the clinic. For the purposes of lab, when you're done with the paraffin wax, when we peel it off, you're going to put it back into the container. Okay? Then what we do is we crank up the heat on these units so they don't breed bacteria at night. For the purposes of clinic, it depends on what their policy is. Some people pitch the paraffin, some people maintain it. The paraffin is highly flammable. Okay? So there is a disposal way you have to get rid of it. You can't just throw it out in the trash, because if there's any kind of spark of heat, it'll go up. Okay, very, very flammable stuff. Okay, so then at the conclusion, so we have a couple of techniques for that. So one of the things also I want to tell you about is that the duration of the heat time for the dip and wrap is 20 minutes. Okay, you are typically treating for subacute problems, sometimes more chronic problems as well, like osteoarthritis. And our normal response to paraffin is going to be pink, oily skin with perspiration. Okay? If you see very red or blisters, it's a burn. That's the adverse effect. You don't want that. The heat should feel comfortable enough, and it should cool with time. That's the instruction to your patient. If they wiggle their fingers, they will crack the paraffin, and then that lets air in. Then that rapidly cools the area, and it's not nearly as effective. So it is very important to tell your patients not to move their fingers when they're doing this, okay? So now, Dr. Schuett's going to be my patient. So he's already washed his hand, and he already has
Actually, I did.
no jewelry.
Use both fingers.
Oh, look at that. Nancy. So you remove jewelry, and he did that both. So now he's going to come over, and I'm going to instruct him in the dip and wrap, okay? So we are going to pull this up, and you're going to stand right in front of this. Let me move so I'm not blocking the camera. Okay. So what I should do, whoops, see, wrong. I need some things set up ahead of time.
And while you're doing that, who wants to figure out which joint is affected? You can do that really easy just by vision and palpation. Somebody come on up. Somebody be right.
Oh no, I have to. As soon as you said it.
Instant regret. It's fine.
Just by looking, do you see subacute, so there's no acute redness.
Sorry.
One joint.
Just by
But that's close to it. She picked this one. In that case, looking at either hand, of course I gave it away that it's this hand before.
The middle?
Which joint looks a little bit large? Now, go ahead and palpate, squeeze here, and feel the, yeah, I can feel the bone. Go ahead, squeeze, it won't break. Okay, and now squeeze this one. Feel how it's a little squishy under there? Very lightly. Okay, there's just a difference in, yeah, okay, a little capsular swelling there. And that, it's not acute because it's not red and swollen, but classic OA symptoms are stiffness in the morning, and I wake up and I have to go 5 or 6 times by the time I'm out of the shower. And this is recent onset as of about 8 weeks ago. So when I had an opportunity for this, I'm like, no. I used to do this in the clinic a lot for patients with OA and RA. It's the way to go. Absolutely the way to go. If you've ever had your hand, somebody decided you didn't have paraffin, so they wrapped it in a hot pack and had you sit for a while. Anybody ever had that done? That's a nuisance. You're just sitting there. It's not. If you have this is the way to go.
Yeah. Okay, so what we're going to do is we're going to tell Dr. Schuett to come over here, stand in front of the paraffin. Now, if you noticed on the side what I prepped 2 towels folded over already. I prepped the wax paper and I prepped the rubber band, so I don't have to fumble once he comes out. He's going to spread his fingers apart just enough, and he's not going to move his hand when he puts it in. He's going to put his hand into the paraffin enough to come up to his wrist and then take it out. And we're going to dip 6 to 12 times. Okay, so go ahead.
Can you look at which one first is that?
No.
I will tell you, that first plunge is quite warm.
It's hot. It's 125 to 127. Okay? Now if you guys can't see what it looks like when it comes out, you got to turn to the side, come around to the side. Do you see? Mm-hmm. Okay? So that's 1. 2. You see how he's holding his hand still and it's just dripping off? 3. 4. 5. 6. Does it feel like you've got a good coat? Or you
Oh
want
yeah,
to do
no,
it?
that's good.
Okay. So then after that, what he's going to do is we're going to turn, okay? Turn this way so everyone can see. Okay, so his hand looks like a wax glove. Okay, now I'm going to wrap his hand in paraffin. You don't just use the terry cloth. Sorry, wax paper. Okay?
And the patients want to bend their fingers here. Don't do it, don't let them do it.
Yeah.
The tendency is I just wanted to curl up like that.
So now I have this sealed. So what I'm doing now is I'm preventing heat escape from the wax. So we want to seal it. So then you need typically 2 layers. If you use 1 towel and it's small, if I have 1 layer like this, that would be 1 layer. If I have a folded one like this, it's technically 2 layers. So So I need 2 layers of toweling to go on top of that. So I usually have my patient hold that, okay? And then I will have them wrap around, okay? And then we tuck in the edges. There's different ways of doing it. You can tuck under like that. Some people just fold and secure rubber band here and secure rubber band down here. You can't leave the distal end exposed to the air because air will come in and will release the heat. So then I'll take a rubber band and I'll secure one there. And I'll grab another one. Oops. And I'll put it there, okay? Then I will have Dr. Shu get into a comfortable position somewhere. Yeah. Okay, he's gonna do both.
This is the one that works.
Yeah. So then what we're gonna do is take those that we have wrapped up.
Looks like he's got
actually gonna get into a
restraints.
comfortable position.
Like the
And we're gonna
boxing.
elevate, we're just gonna get him comfortable, and he's gonna sit and rest. Then I have a timer preset here that says 15 minutes, and rerun it, okay? And we'll hit press, and we'll press start when he's done with this other one, okay? Someone wanna try it now? You want me to